Kathleen Sebelius. Madam Secretary, thanks very much for joining us.
Great to be with you.
How are you going to pay for $1 trillion, if not more, for this health care reform over 10 years?
Well, President Obama has outlined his preferred payment plans, about $660 billion in savings out of the existing system. So money that's already in the system that's not making us healthier and going to procedures and practices that work very well, and about $330 billion in a proposal that would cap the itemized deductions that the wealthiest Americans take, return them to the level where they were in President Reagan's days. The House and the Senate have slightly different variations, a lot of the same savings, and they're looking at different funding.
Because the House version that Charlie Rangel, the chairman of the Ways and Means Committee, announced on Friday would tax the wealthiest Americans, additional tax to help pay for the hundreds of billions of dollars that would still be needed if you make more than $300,000 a year or $400,000 a year and make more than $1 million. You're going to be paying a lot more taxes in the years to come.
Well, the House has a version. There are a couple of different proposals being worked on in the Senate.
You like the House version?
I think that it's one of the ideas that will be discussed in the long run. I prefer the president's version. I think it makes good sense that, you know, again, the wealthiest Americans pay.
But you're open to the version of increasing taxes on the richest Americans to pay for health care for everyone else.
Well, I think the bottom line is it's got to be paid for, and that we all have a shared responsibility, that we all need to play a role. The House and Senate version also have employers included and individuals included. And what's been remarkable, Wolf, is the stakeholders who in the early 90s were the most vocal opponents of anything changing in the healthcare system are really at the table with their own suggestions of how to pay for systems.
Just to be precise, you're open to Charlie Rangel's proposal?
Well, I think everything is on the table and discussions are underway.
Are you also open to taxing health care benefits that employers provide their workers?
Well, I think, again, the president's made it pretty clear from the beginning, certainly during the course of the campaign and since then, that that proposal may well dismantle the current employer-based system. He has always suggested that we want to build on the current system. 180 million people have insurance provided by employers. What we don't want to do is discourage employers from offering coverage.
But this is what he said back when he was a candidate in September of 2008. I'm going to play this little clip.
Okay.
Everyone in America, everyone, will pay lower taxes than they paid in the 1990s under Bill Clinton, at a time when the economy was growing and we produced 22 million new jobs.
All right, so just to be precise, you're rejecting a proposal to tax health care benefits that employees get from their employers.
Again, Wolf, the House and Senate are busily at work, and I think the president continues to reemphasize that he has opposed the notion that we would tax health care benefits, continues to think that is not the best strategy to go forward. If at the end of the day that's the chosen way, I mean, the House clearly doesn't have it in, the Help Committee doesn't have taxing benefits as part of the proposal. We're waiting to see what Finance comes up with, but he continues to work with the Finance Committee saying this is not the preferred strategy.
Not the preferred, but it's not necessarily completely being ruled out.
Well, no lines in the sand at this point. The most important thing is a health care reform bill passed this year, comprehensive reform, because we can't afford to pay what we're paying right now. We're paying twice as much as any nation on earth, living sicker, dying younger, and that isn't good for any American.
Will the president accept health care reform that does not include a public option? In other words, public government-run health insurance companies competing with the private health insurance companies?
Again, he has said consistently and very strongly a public option is one of the strategies that will help lower costs, provide some competition for private insurers, and make sure that consumers in many parts of the country have a choice. Absent that, you won't have cost competition and you won't have choice.
So be precise. Is the president going to reject any, if the House and Senate says, you know what, we can do this with co-ops, we can do this with other ways, but there's not going to be a public government-run health insurance system, is the president going to accept that?
Well, I think you're going to hear from senators in a little while about a variety of strategies to get to a public option. There isn't one size fits all. So I think the president has said, we can have competition. The issues are competition and choice, and how you bring that into the private marketplace. There probably are a variety of strategies, all of which are on the table. The good news is that Congress is hard at work. We've got Republican senators working day in and day out with Democratic senators trying to figure out how to make sure reform happens this year, and they're working really hard.
What is the president going to say? You know what? Enough. The House and the Senate, they've got their own versions. I'm going to come up with a Barack Obama version that I want you guys to pass.
Well, everybody assumed that I had the 1,000-page plan in my purse as I traveled through the Senate for my pre-confirmation hearings. What the president understands is that this package of legislation, this very comprehensive bill, needs to be a bipartisan approach. It needs to be owned by the House and the Senate with lots of input from the administration. That's exactly what's going on now. Progress is happening day in and day out. People are at the table. Senator Grassley is working hard with Senator Baucus and Senator Conrad and others. I think we're going to have a bipartisan bill with not only votes from Republicans and Democrats, but lots of ideas from Republicans and Democrats to reform the health care system.
Let's talk about the swine flu. You're getting ready. The flu season is going to be starting in the fall.